Good afternoon, everybody. Welcome to this week's Independent Sage briefing. Yesterday, the official coronavirus count rose by a quarter in 24 hours to over 17,500 new cases. And there are warnings now that hospitals in some regions will be overwhelmed within a couple of weeks if the rate of increase isn't quickly flattened. Meanwhile, National Test and Trace has had its worst week in terms of close contacts being traced. There's a lot to mull over, but let's start as usual with the facts and figures. And after that, we'll go straight to questions from our special guests, press, and members of the public. Here is Professor Christina Pargel with the latest figures. Christina, over to you.
So, hello everyone. I hope you can see the screen. So, it's not a good news week. There isn't really any good news. So I'm just going to start by saying that. And I'm going to spend the next kind of 10 minutes or so just kind of going through a little bit on testing, looking at new cases and new infections, doing a kind of international comparison, and just kind of ending and kind of where we are and where we need to go next. I just wanted to start with a number of new tests by nation. This is per million population. And you can see this is just over the last month. Oh, let me just go back. You can see that it's been really flat, and it's only really in Northern Ireland that there's been an increase over the last few days. And I just wanted to put that there so that it puts into context the case numbers, so that increases that we're seeing are not because we've been testing more, right? They are actually because there are more people with infection. I'm also not going to really go into test and trace this week. The results have got worse. As Alice already said, they've either stayed the same or got worse. And also they did get the extra 16,000 cases that got mislaid, got into last week. So it's kind of not clear exactly how to interpret them anyway. But I am just showing this graph, which shows the proportion of test results received promptly. This is English data, which isn't affected by what happened with those 16,000 cases. And you can see that the time taken to get them has gone up. So this metric of getting it quickly has gone down for everything except satellite test centres, and that's care homes. So it does seem as if they are prioritising trying to get results to care homes quickly. I think that's a good thing. But we are struggling in not just getting tests, but getting test results back quickly. So this is the number of new UK confirmed COVID cases. Now, there was obviously at the weekend, it came out that they had mislaid 16,000 cases. Well, 15,000, I think 841, not 481 that I wrote there. And they did actually say where they should have been reported. So I've kind of back allocated it. So this is what I think the graph should look like. And I just averaged over for the weekend. But either way, you know, it's pretty clear things are going up. I don't think the testing data is reliable enough, or the case data reliable enough to calculate doubling times from it. So I'm not going to do that. But, you know, we're rapidly now approaching 20,000, which isn't something I thought we were going to be saying 4 weeks ago. If we look at the number of new cases per 100,000 people, so we can kind of look at rates across the different nations, Northern Ireland has really had a surge over the last 2 weeks. So, you know, from the week ending to the 25th of September to yesterday, it has really shot up. It's almost tripled. And then England is the nation with the next highest rate, followed by Wales, followed by Scotland. And if we just look at the map, oh no, this isn't the map, sorry, this is the ONS survey that just came out today. And what this shows is that the increases that we're seeing in testing is real. I mean, I think it's real. I think we didn't really doubt that, but this is taking a random sample. So this doesn't depend on our testing, and it doesn't depend on people getting a test. It doesn't depend on how quickly those test results come back or anything like that. This is just testing a random subsample of the population across, this is England and Wales. And from the data they released at midday today, you can see there is this kind of steady increase It doubled in these 2 weeks. These are 2-week intervals, and it's more than doubled in the last 2 weeks of September. And so we're kind of approximately 2-week doubling. It's getting a bit quicker. And that is consistent with the King's College COVID Symptom Tracker app, which is also currently at about 2 weeks doubling. The REACT study from Imperial, which tested 150,000 people, that's literally just published about 5 minutes ago. I just looked at the headline. They are also seeing about 3-week doubling, but they're saying it's much quicker in the north than it is in the south. So we're going to look into regional differences next. So this is a map of cases over a single day. I normally show this by week, but because of the impact of adding 16,000 cases at the weekend, I don't think that's a fair representation. So this is just a single day. But you can see definitely, hotspots. You can see Northern Ireland, you can see southern central Scotland, you can see the northeast, Yorkshire and the northwest, but it's certainly not just there. So thinking it's just the north or just Northern Ireland or just Scotland is not right. We are seeing, high cases in a lot of different places over the UK. So if we now just look a bit more closely at England, this is the number of confirmed cases per 100,000 people by region here, and you can see here very clearly the northwest and the northeastern Yorkshire are by far the highest and increasing more rapidly, followed by the Midlands and London, and then east of England, southwest and southeast. But everywhere is increasing. So it's not as if there's somewhere that's not increasing. Now, there are rumoured to be new restrictions coming in that are going to be done by tiers, and apparently the first and second tier are separated at 100 cases per 100,000. So that would be here. And then it's not quite clear where the highest tier would come in. But we can see at the moment that would definitely put the north above that threshold. And presumably the Midlands would hit that pretty soon. This is just another way of looking at it, which is looking at the positivity rate. So this is saying it really isn't to do with testing. This is a proportion of people who are testing positive in England regions. What it's also, we're now at over 10% in the north of England, and we were, 2-3% for the summer. And this is worrying because what it's saying is that we really should be doing a lot more testing. The WHO says that if your positivity rates go over 5%, you need to do more testing because there are too many cases that you're not catching. And I think we're in that situation now. Scottish data, I think, showed yesterday that Scotland's at 13% positivity rate. So again, Scotland really needs to be trying to increase its testing capacity. Going back to the ONS survey, we see exactly the same picture here in terms of regions. We see the northeast, the northwest, and Yorkshire and the Humber being all very, very high and much higher than the rest of the country. So you see the north, and then you see East Midlands, London, West Midlands, exactly what we saw in the case data, followed by the rest of England. So that is encouraging it's encouraging that we have two very consistent sources of independent data, so that we think this is definitely the situation. The situation itself is not encouraging. Just moving to age group, this is from Public Health England data they published yesterday. And this is looking at case rates again per 100,000 by age group. And pretty much all age groups are increasing except 5 to 9-year-olds. But by far the biggest increases is 20 to 29-year-olds, and then the 10 to 19-year-olds really have shot up over the last 2 weeks. And when I saw this, I was like, oh, well, 10 to 19, unfortunately, covers like two really distinct groups of people. It covers children in secondary school, but also people over 16 doing kind of A-levels and higher, and then early university students. So it's kind of, how do you break that down? And ONS, which published today, has actually done it in a more kind of easier to interpret way. So there you can see that increase that we're seeing in case numbers is really concentrated in this bracket, which is basically 16 to 24-year-olds, is where the increases are really accelerating. And although for the other age groups it's going up, it's not going up nearly as fast. So I think in terms of keeping schools open, it's very encouraging that there's not actually that much change in primary schools. And although younger secondary school children is going up, it's not going up anything like this bracket. So, you know, we've seen that cases are rising, and we expect that to come with hospital admissions. So I'm going to be looking at hospital admissions now. And the other thing about hospital admissions is that that is the most comparable data to what happened in the spring. Because cases you can't compare, because in March we just weren't testing anyone in the community, you only tested people in hospital. So we just can't compare that. And deaths you can't really compare because we just got a lot better at treating it. So hospital admissions is kind of our best way of seeing, okay, well, where are we now compared to where we were then? So these are number of new hospital admissions per day in England. Again, I've chosen England because the other nations, the admissions are still quite low in numbers, so less than 10, so you can't really say that much about trend. But in England, you can see there has been a rapid increase this is up to the 7th of October. Beginning of September, it was really quick. It was like every 8 days, and then it slowed down. And last time I showed this plot, we were 18-day doubling, the kind of the green line, and we've got faster again. So this is kind of, if you just did it over the whole country, it's 14 days. And that's kind of consistent with what ONS was saying as well in the COVID symptom tracker app. But it doesn't really make sense, I think, to just fit it to the whole of the country, just because we know that the North is experiencing a lot more admissions, and most of these admissions are in the north of England. So I think we have to separate it out by region. And so this plot is looking at the 3-day average of the daily number of new admissions with COVID per million people in the different regions in England. This is from NHS England data. And you can see that there really is this really rapid increase just over the last couple of weeks in the northeast, northwestern Yorkshire. And just fitting an exponential, just to kind of get an idea of where that's taking us. The northwest is kind of looks like it's at 7-day doubling, and the northeastern Yorkshire slightly slower. But either way, in a few days, they'll be at 40 daily admissions per million people. And that's pretty much where London was on lockdown day in March. So we've kind of, in the north, got, you know, just a few days before we're back at that level of capacity, and it will keep going up unless something changes. And that is quite worrying. And I saw, like for instance, in The Guardian today, they said they're worried about running out of capacity within a week. So I think the situation there in the north is quite serious. Looking at deaths, this is from Office of National Statistics. Everyone who has COVID-19 on their death certificate, it's continuing to go up. So almost 70 cases from the 18th to the 25th of September extra. And that will keep going up as long as hospital admissions are going up. But we are still nowhere near where we were at peak. And I very much hope we never get anywhere near there. So just looking at other countries. So we know that Spain and France have been having an increase, and they started increasing a few weeks before the UK. Spain really in July, and France in August. However, we have caught up. So our increase over the last few weeks has been incredibly rapid. Germany and Italy are seeing increases, but nowhere near the scale that we are yet. Although, you know, as we've seen with the UK, things can change quickly. Now, case numbers are a bit difficult to interpret. Every country has different, you know, not necessarily different criteria for testing, but it's not directly comparable exactly what who they test and how they report it. So we looked at hospital admissions. And this is weekly admissions per 100,000 people. It comes from the European Centre for Disease Control. And you can see that Spain was increasing pretty rapidly after the cases started increasing in July, but that has started coming down. This is new admissions. France also increased rapidly, and it now seems to be slowing down slightly. We don't have the latest week yet for either country. And again, the UK is now rapidly catching up with France in terms of hospital admissions. And in Germany, and I've put Ireland in here as well, there really hasn't been any increase in hospital admissions, at least to date. So that's kind of where we are. So to summarise, COVID seems to be spreading quicker again across the UK, particularly Northern Ireland and the north of England. Hospital admissions in the north of England are increasing really rapidly. And if that goes on, they will reach levels seen in London on the 23rd of March, within a week. And the reason I mention that is because London hospitals were almost overwhelmed. And that was still given that lockdown happened on the 23rd of March. So I think in the north, we do have to worry about hospital capacity. Test and trace is getting worse. And as case numbers continue to increase, that's likely to continue. Like, the more people there are to track, the harder it gets. So there's no particular reason to expect it to magically improve right now. I think the existing restrictions are not sufficient to reverse growth. If they were, we'd have seen it, and actually we're not at all. And we do now need to do that. Kind of time has run out for us to wait and see what happens, I think, and that's particularly true in areas with the high case numbers and high hospital admissions. So I think the government urgently needs to halt and reverse growth, and it needs to do that now, not next week. I think we do need to have additional temporary restrictions. They have to be really clearly communicated, and they have to be transparent with clear criteria for exit, so people understand how a region gets into those restrictions and gets out of those restrictions. I think we need to return to 2-meter distancing. We have to emphasize mask wearing indoors, switch to online teaching in universities. We're seeing that it's university age people that have by far the highest rates of COVID at the moment. And we have to try and reduce that transmission somehow. We really need to support households to isolate. And I know we've been saying this for a while, but it is so important. Whether they have COVID or they're a contact of someone who has COVID, they need to be supported financially and practically, and just logistically, especially if they have like caring responsibilities or in overcrowded housing. We have to support businesses and those whose livelihoods are impacted. If we're going to add restrictions, we have to support people who will be impacted by those restrictions. And while we're doing that, we have to be increasing test capacity and turnaround times and redesigning and improving contact tracing. We have to have a system in place so that when those restrictions end, we don't have to go back there. I mean, that really does need to happen. And finally, like we've been saying all along, schools should only be closed as an absolute last resort. And finally, the government must return to its daily briefings. I don't understand why now is not as urgent as it was in March. I think we do need to hear every day about what the plan is, what the situation is, and how they're making decisions. And that's it.
Thank you very much, Christina. And I should welcome a new member of the team actually at this point. So Dr. Kit Yates is a senior lecturer in mathematical biology at the University of Bath and the author of The Mathematics of Life and Death. So welcome to Independent Sage, Kit. And we're going to go first to a questioner, Michaela Thomas now. So we're straight in with the questions. Michaela, are you there with your question?
Yes, I am indeed. Thank you very much for inviting me and allowing me to ask the question in person. I've been following this series right from day one, and I've been comparing to what other countries are doing. So I've been listening to the podcast of Professor Drosten, who said, you can use the app, but also keep a diary if you don't have the app. That'll do to find some clusters, which is what we're after. My question is twofold. You mentioned the admissions just now. Admissions to hospitals don't mean that much to me if I don't know the capacity. So I've just seen a map from some other countries where they actually pointed out where the capacity was reached so that you can pinpoint it down to the region. But my real question is, how do you explain the difference between the north and south? Are we actually talking about a north and south divide, or are we already in a second wave? I mean, if I look at London, Richmond is affected, which is one of the most prosperous areas. I live in central London. I know we had school closures they haven't been made public. But what is your idea from a scientific point of view, what is happening up north? And when we say the north, it's possibly not the Dales, it might be somewhere else in the north.
Gabriel, would you like to take that? How do you perceive this north-south divide that seems to be there on the map?
Well, I think one of the most interesting things is, and probably the explanation is just the sheer level of disadvantage in those particular areas. We do know, because there was information which was leaked from Public Health England, that even at the end of the last lockdown, several local authority areas in Greater Manchester still had the virus spreading endemically at that point in time. So it isn't really surprising, with further lifting of restrictions, that it should be that whole band of local authorities across the north and Greater Manchester in particular, which has seen such large increases, because it never really went down to the sort of levels that it did elsewhere. And that was the problem of the government choosing a one-size-fits-all approach. The other thing that came out of that data set was that those local authorities, the ones who never got it down and had it endemically even at the end of the lockdown, had three distinguishing features. One, they had a high level of deprivation. Two, they had a high level of overcrowded housing. And thirdly, they had a high level of people from BME communities. And those three factors come together. And it's a perfect breeding ground for the virus. So it's not at all surprising to me that the north and that band across Greater Manchester and beyond is really the worst affected.
Zubaida, I know that you would like to comment on that question as well.
Well, yes, I think I want to absolutely echo Gabriel's point about the perfect storm of factors of deprivation, overcrowded housing, multi-generational housing, as well as concentration of Black and ethnic minority communities. But the point is we've known that from the outset. From the outset, we have known that certain communities in certain areas are much more vulnerable to COVID-19. So I think the bigger questions are, why wasn't more measures taken long beforehand? Why wasn't the test and tracing much more stronger in the areas and with the communities that we've known have been much more vulnerable? Why hasn't financial support, including statutory sick pay, as well as localized furlough schemes, been there from the outset? Why haven't those structures been there? And that's a really important question to ask, because the other issue is, we know from recent data, when it comes to hospitalization cases, that approximately a third are from Black and ethnic minority backgrounds. Now, that's fairly consistent with what we've seen before, but it does beg the question, given that the government came out with a review on inequalities and Black and ethnic minority groups more likely to die with COVID-19, what more has been done? And in fact, why hasn't there been more done to protect these communities? Why has the government waited until crisis point?
Anthony Costello, I know you'd like to comment on this question as well.
Well, just on the scientific point, Carl might have a view here, whether this is a secondary phase of the first wave, and whether a second wave is more correctly described as when you lose immunity. Interestingly, there's a paper in Nature Medicine published this week, which looks at responses and reinfections with all other coronaviruses, showing that almost every year you're getting repeat infections from the same coronavirus, which suggests that immunity is quite readily lost, which really blows cart and horses through the herd immunity brigade. But my explanation is simply that this ripples out to different communities at different rates, as it has done across Europe. And that we're seeing, we've seen it surge more quickly in the north, maybe because they're more exposed or at a different stage of the epidemic. But already you're seeing it's coming back into London now. London's all black, the on your chart. So, I think, I don't know, I'd be interested to know what Carl thinks about that.
Carl, would you like to comment at this point?
Yes, thank you. So I think that's a very important distinction between a secondary wave and a second wave. If it's the case that we lose immunity for a host of reasons, then that is very worrying in the sense that we will be continually exposed to second waves in the same way that we have seasonal influenza. Most of the modelling at the moment points to a secondary wave as a best explanation of what we're currently experiencing. And indeed, it looks as if our acquired immunity at a population level is not falling away sufficiently quickly to endanger us in terms of having a second wave proper after Christmas. One nuance to what I think is Anthony's very nice description of it rippling into regions that have hitherto been less affected, basically the virus doing a tour of the country. A nuance that it's not just regions, it's different communities. So within any locale, different communities who didn't experience a severe first wave are more likely to play host to accelerated viral transmission and morbidity in the second wave. So there's a slight yin-yang, both at the level of regions, possibly even countries, but also at the level of communities within any region. And why that is important is that it speaks to population fluxes and transmissions between communities as an important factor in containing and attenuating viral transmission. So it's an important distinction between a secondary and a second wave. There's nothing we can do about a second wave other than vaccination. But there are things we can do about secondary waves by just thinking about the population mixing, the segregation and regional variations that have this very heterogeneous effect in terms of both space and time where the virus is expressing itself.
Thank you very much, Carl. Fascinating question. Thank you very much for that, Michaela. And a lot about what we're seeing and why we're seeing it. Now I'm going to invite a question which is about responses and about alternative responses. Kevin Gemmell, are you there, Kevin?
Yes, hello. In the last week or so, we've seen considerable traction in the media, social and mainstream, regarding the Barrington Declaration that proposes herd population immunity approach from a small fringe group of scientists. What actions do we believe need to be taken to ensure this somewhat divisive alternative doesn't undermine the public trust in the evidence-based approach suggested by Indy Sage and the vast majority of scientists? Perhaps one for the behavioural scientists?
Is there anybody who'd like to jump in on that? Stephen Reischer, you've got your hand straight up.
Well, the individual scientists have got every right to question assumptions, to challenge assumptions, but we have to recognize that they are a small minority. I mean, every significant organization, the World Health Authority, the Centre for Disease Control in the States, the European Centre for Disease Control, the British Medical Association, the Chief Medical Officer, the Chief Scientific Officer, every single significant organization rejects the herd immunity point of view. And the real problem, I think, is in the way in which it's been represented and the way in which it's been boosted by the media. The media, I think, are tired of hearing the same old thing, even if it's true, and they quite like controversy. So they quite like to set it up as two equals. And so in that way, a small fringe and a small minority and a very small number of people are set up as if science is split, as if there are two equal camps. It's a little bit like saying, I don't know, that the world of music is split because two people come up and say Jedward are the greatest musical act of the 21st century. Science is not split. There are not two camps. There are particular individuals. And I think it's very important that the media take their responsibilities seriously and report accurately and show that, yes, there is a scientific consensus, and there are one or two people who are saying, lock up a quarter of the population and send out 3/4 of the population to their doom when you don't know the effects of this disease. And it's not surprising it's a minority position, and it's not surprising that it's a position that is rejected by virtually every scientific organization.
I wonder, Susan, if you'd like to comment on that, and then Gabriel, I'll come to you.
Well, just to add this issue about the social responsibility of the media, because we're in a situation where sadly the trust of the population in the government to handle the pandemic has never been lower. I think it's plummeted to somewhere under 30% now. And in the absence of trusted leadership, there are real problems in terms of adhering to guidance, in terms of groups accepting different types of conspiracy theories or false ways of looking at things. And compared to politicians, scientists do have much higher trust in the population. And so within these absolutely desperate situations where we are talking about life and death of thousands of people, for the media to present this as an equilibrium, as a kind of even-handed scientific debate is undermining the trust in scientific leadership in this country. When, as Steve said, all the organisations, including this one, would not support that very fringe point of view. So I would really appeal to the media at this critical time to really take their responsibilities seriously and cease from doing this any longer.
Gabriel, you wanted to comment on that as well.
Well, I do indeed. And I think it's important that public health physicians engage with this, because these people are saying that they are producing this public health expertise. And in fact, it's nothing of the sort. Herd immunity, the artificial creation of it through the spread of a dangerous virus, is a bonkers idea to anyone who understands public health and how it operates. They talk blithely about shielding or aggressively protecting the vulnerable minority, but that it's not possible to point to countries around the world where the virus has spread as much as would be necessary to produce herd immunity, according to this group, that it doesn't breach any barriers that can be put in place. Who goes in and out of the care homes or the hospitals? And we've seen 3 hospitals now in the UK where we've had serious outbreaks in the hospital, and that's with the virus at the relatively low levels compared to the levels they wish to see. Secondly, they never mention long COVID and the trail of disability that is leaving behind it. And we're learning more and more about that. And thirdly, although they talk about protecting the most vulnerable, they don't say who exactly those are, how it would be decided who got protection and who was left to their own devices. There are a lot of people not with high risk, but with moderate risk, all over the place, in all of our workforces, in all our communities and our households. They have moderate risk, but there are millions upon millions and millions of them. And leaving them open to moderate risk in huge numbers will result in very large numbers of people who get the virus and suffer badly from it and die from it. So it is an idea without merit. And we also need to note where it comes from the American Institute for Economic Research. That's where Great Barrington is. And their mission in life is to promote ideas of pure freedom and private governance. And that very phrase probably tells you all you need to know about where this comes from.
I think it is incredibly important in terms of media responsibility, and as you say, Gabriel, looking at connections and looking at where those voices are coming from and who they're supported by. From my perspective in public engagement in science, it seems to be something very, very similar to what we saw with climate change denial and also the tobacco lobby as well. But Anthony Costello, I know that you wanted to speak here as well.
Very quickly. It's being portrayed as libertarianism versus lockdown. And that's a nonsense. I just point to, Christina gave a fantastic presentation, and one of the slides showed how Germany and Italy are keeping things really damped down. Compare that with the US, which is basically a take it on the chin policy, where you're getting masses of cases, masses of deaths. It doesn't need to be this way. The reason we're running into trouble is we didn't set up a proper find, test, trace, isolate program back in March, April time. We had a chance to reform it in August when all the evidence pointed to the fact that it wasn't working through this privatized, centralized system. We didn't do that. And hence, as we start to open up, you get surging cases. Now, if we had a proper find, test, trace, isolate, like Germany, like Italy, like most of the Asian states, and like several other poorer states like Senegal and Vietnam, we wouldn't have this problem. So it's not a choice between mad libertarianism and national lockdowns. We need to lock down the cases and contacts, and we could do that. And it's a national shame that we haven't set that up.
Thank you very much, Anthony. Just before I go to the next question, I should point out that there is a report on problems with this herd immunity idea on the Independent Sage website on the front page. So if you Google the website and land on it, it's right there. And the next question comes from Chris Karkar. Chris, are you there?
Hi there. Hopefully you can hear me.
Yes.
Great. I don't know why the video is not quite working, but there it is. So Anthony just mentioned about sort of lockdowns being potentially imposed if you could find, test, track, isolate. Obviously, there's a bit of a problem with that. And Christina mentioned restrictions, which are likely to be coming into play. Currently, the government is having a policy of very localized restrictions. My question is whether that's suitable, or would implementation over larger areas, either county or regional, be more effective? And my question is basically because the virus presumably spreads from high infection rate areas due to the movement of people, either because of necessary travel, whether commuting, for example, or in some cases, no doubt, also in order to circumvent those little localized restrictions which have been imposed on those high infection rate areas. So is the scale on which the restrictions are imposed, is that appropriate at the moment, or should it be increased?
So should we be going ahead with this piecemeal but localized approach, or a more national approach?
Not necessarily national, but for example, Greater Manchester, Trafford's has restrictions, but a friend of mine in Altrincham, he's quite free to go about his business right next door, and people in Trafford can go to pubs in Altrincham if they wanted to. So I'm wondering whether, especially in towns, and you had a previous questioner who was from London and mentioned some areas in London which were having some issues where other areas in London might not.
So Zubaida, how do you see the reaction at the moment and the way that lockdowns or restrictions are being imposed?
Well, I think it's an excellent question, and it's on everyone's mind, isn't it? That why are some areas getting restrictions and other areas with equal number of infection cases, or if not higher, specifically in London and down south, they're not. And that is a good question. Except I wonder if we need to go deeper, and rather than asking, should we have national versus local lockdown or restrictions, we should be asking, well, what is the explanation? Where is the clarity? Where is the clear communication? And I think that's where some of the real problems are at the moment, where government is implementing these restrictions last minute, 11 o'clock at night in the papers. That's when local mayors find out, with very little explanation and consistency, even within areas, as rightly has been pointed out. And that really confuses people. And I think that really challenges adherence, because people don't understand it. People think, well, I can travel to just outside my area to the pub. It really does challenge all of those issues. But I think the other issue we need to talk about in terms of restrictions, and I'd rather talk about restrictions rather than lockdowns, is the economic support around it. It is so fundamental. It is something that Independent Sage has repeatedly raised, which is if you have localized restrictions, then you need localized and tailored furlough schemes. I mean, businesses with lockdown, inverted commas, businesses are going to the wall. Jobs are going to the wall. So restrictions really should be a last resort. But the last point I want to make is it's not just about restrictions. As Gabriel and others have said on Independent Sage, where is the conversation about test and tracing? the government has poured 12 billion into privatized Serco and Deloitte led test and tracing, which has failed. It has failed because they're public management consultants. They're not experts in epidemiology, they're not experts in public health. 12 billion. So I think we need to ask questions around that as well.
Professor Talila Oni, I know that you had a comment here as well.
Yeah, thanks. I think just picking up on Zubaydah's point, there too, I really want to stress your point around the importance of not focusing just on restrictions as if the restrictions are the prescription. If we take a step back, and I want to touch on two things, the what and the why. The what we're trying to do is actually break transmission cycles and reduce community transmission in the community. So when you think about that, you don't think, well, what is the community transmission at the moment? And that guides what has to be, what needs to happen, and how can that stay down? So at this point where we are now, which was not an inevitable point, the number of cases are so high that it's difficult to see beyond restrictions as the way to kind of reset that in some way. But that shouldn't be conflated with thinking restrictions are the prescription. And then the second point really is the why, because, and that picks up on the point that was made earlier about the differences we're seeing certainly across England, for example, with the North. There are things that we've known all along. You know, we've talked about the deprivation, we've talked about the overcrowding multi-generational households, high minority ethnic groups. There are other kind of broader upstream things that we've known in terms of the investment in the local. So we know that the localized approach to this is the most effective. If you look, for example, at the report, the Marmot Review report 10 years on, which was published just before the first lockdown, and that showed that if you look at the local authorities between 2010 and 2018, where the cuts were greatest, the more deprived the local authority, the higher the cuts, and that's been sustained. And if you look at the highest cuts, they were in the north, northeast, northwest. So when we talk about then needing to activate and mobilize local authorities and local action to intervene in ways that are better tailored to the community, we start to understand the more structural issues. So when we start talking about response, I would really love us to, okay, we're urgent to the moment and cases are going up, but if we talk just about circuit breakers now, you know, in a month, in 2 months, we're back in this position. If in March we'd said, okay, we've got this issue around this pandemic that we have to deal with now. We also have this report which shows vastly growing health inequality across the country. That is actually as important and as urgent. What would have happened if we prioritized some of those fundamental inequalities? Would we have managed to reduce the vulnerabilities that might have balanced things a little bit and made population health a little bit more resilient? So I think it's really important that we see the strategic efforts to narrow those vulnerabilities as urgent as the immediate efforts to break community transmission.
But in terms of those immediate efforts, Talila, do you support the region by region approach that's happening at the moment?
I think it depends on what we mean by support. Sorry, I don't know. Susan, did you want to say something?
Well, I think the current situation is a bit of a mess because it's, as has been said, it's unplanned. There's not a consultation. It's not being done with the relevant local bodies. And there's such a patchwork of different arrangements in different parts of the country. And as you said, you know, you have one set where you are, and kind of round the corner is another set of restrictions. And my understanding is that the government is planning to bring in a 3-tier system. I think Ireland's had a 5-tier system, and Gabriel might want to say more about how that's worked. But that would have the advantage that depending on which tier you're in, and the tier is defined by the level of transmission in your locality, there was a very, very clear set of restrictions for that tier. So everybody would know where they were. And it would be uniform across the country in terms of the tier system. Obviously, which areas would be in which tier would need to have very transparent criteria for when you went from one tier to another, and also evidence-based rationale for the types of restrictions. I think one of the issues, though, is how big should those regions be? And I think that's a difficult one. I think that it can't be too small. So I think however you play it, there will be perceived injustice, because if you have it small, it'll be chopping and changing. If you have it very large, then obviously there will be areas that are maybe above the threshold and those that are below. But Gabriel, do you want to say something about how this has played out in Ireland?
Well, indeed, they adopted some weeks ago a 5-tier system, which is very plain and simple to understand. And I think everyone gets it and can refer to it, and they know exactly which each of the tiers is. And the government decided at the beginning of the week to move the entire country to tier 3 of the 5, where 5 is the most restricted. I think one of the things I've learned from my behavioral science colleagues on Independent Sage is the importance of clear and consistent messaging. And I think in terms of the levels of restriction, Ireland has got that right. I like the 5 because there's enough variation between the 5 to be able to move between them without it being a huge difference. And it is perfectly clear and easily understood and very well presented.
Thank you very much. Next, we're going to Amanda Ferguson. He's a freelance journalist in Belfast. Amanda.
Hello, thank you for this facility. It's great to have it. I'm just wondering, listening to politicians in Ireland, and that's in both jurisdictions, Northern Ireland appears to be stalling on implementing further restrictions because of finances. It doesn't have the financial levers, for example, that a devolved nation like Scotland has, and therefore it's dependent on the UK government to move money to allow it to support people and businesses. So I'm just wondering, how damaging is every day that there is a delay from London, and how does the financial side of support from the UK compare to other countries in Europe and elsewhere?
Who would like to take that? Gabriel and then Anthony.
Well, yeah, it's a big problem, Amanda, isn't it? But I really wonder if that really is the restraint. I'm very concerned about the situation in Northern Ireland. In fact, you could see from Christine's excellent slides in her presentation, the acceleration, phenomenal acceleration there's been in cases in Northern Ireland. And there must be an enormous sense of disappointment, because they were down to 0 deaths and down to single-figure cases in July. So to let the opportunity of that level of control slip through their fingers and get to the position that they're in now really takes some degree of neglect of the situation, I feel. I find their absence of data around transparency surrounding, for example, testing and tracing and the length of times around that deeply disappointing. And overall, I think it is an enormous problem, and it's a problem for the whole island, of course. I don't regard the financial considerations as the reason why they're not making changes. I don't think they have a strategy, and I don't think they know what to do.
Anthony, do you think they've got a strategy?
Not really, and I think there's a split. If you look at scientists on SAGE, several of them are implying that we do need to move towards a national lockdown. Some are suggesting that we should have a so-called circuit breaker, which is a national lockdown over a period of maybe a couple of weeks, possibly longer. And I think probably the Chief Medical Officer, Chris Whitty, agrees with these ideas, but the politicians are desperate to avoid this. So there is this, wishful thinking that it's all going to go away. There are risks, because if you do a circuit breaker and deaths continue to rise, they may not then wish to lift it. There are other problems with circuit breakers, but the biggest of all is what we've been saying all along, that Germany and Italy and many other countries have an effective way of keeping it locked down once it is down. And we don't have that across the whole of the United Kingdom. And until we get that in place, putting in national lockdowns and circuit breakers may actually just kick the can, a month or two down the road, but then we'll be back to square one. So we have to address the root cause of this. I suspect we will end up, and looking at Christina's data today, it looks pretty dire. And I suspect that in a couple of weeks' time, the government will be forced, but that's just a personal view, that they'll go into some kind of national lockdown.
Yeah, it's very clear that there is no strategy at all. I've been asking about preparations for, secondary waves and preparations on what happens beyond what's announced every week or so. And there's very non-committal answers are given. So it is definitely a serious problem.
I know there are more people wanting to jump in, but I want to squeeze in a few more questions before we have to finish today. So I'd like to invite Rianne. Sorry, Rianne, I don't know your surname. Rianne is a secondary school teacher.
Hi, yes, I'm a secondary school teacher in Wales, and since returning to school in September, I've tested positive for COVID-19. So my question is it inevitable that the cases in schools are going to continue to rise due to such high numbers of pupils and teachers being in confined spaces, or are there some key measures that secondary schools can take to prevent further teachers and pupils from being infected with the virus?
Thank you very much. It was a bit of a difficult line, if you don't mind muting. Thank you very much. Rianne's question was, are there key measures that secondary schools can take to prevent the spread of the virus, or is it inevitable that cases in schools will continue to rise due to such high numbers of pupils and teachers being together in confined spaces? Christina.
I think that as long as cases in their local communities rise, you'll see a rise in school children and their communities. But it doesn't seem as if schools are increasing much faster than their communities. I think given the data that we're seeing on 16 to 24-year-olds, there might be a case for switching to online learning for 16 plus, if there is support to do so, and there's provision of good computing facilities for people in disadvantaged communities. I mean, that has to happen, otherwise you're just going to exacerbate the existing inequalities. I mean, all the things that we've been recommending all along about ventilation, I mean, now I think there is also a case for wearing masks in the classroom as well as the corridors, social distancing. We have to be really strict on that, particularly now that it's becoming clearer that it is a bit more airborne. So social distancing is really, really important. But I think, trying to keep schools open as long as possible is really what we have to do.
Susan, you'd like to comment on this schools question as well?
Social distancing is very difficult in a lot of schools when you have the numbers of students and the space just not allowing it. And something we've raised in this group before is the strategy of there's lots of empty buildings around, and taking over empty buildings that can be used as classrooms and bringing back retired teachers, much in the way that retired doctors and retired nurses were brought back earlier in the year. And this would maximise the chance of children being able to carry on at school whilst having social distancing, which will be really important to stop the transmission increasing in schools, just as is happening in the rest of their communities. But so far, the government doesn't seem to have taken us up on this idea.
Yes, I think at the moment there are no extra resources for schools in terms of space or staff, and they just have to try to manage with what they've got. Staying on the subject of children in this pandemic, I'd like to invite a question from Louise English. Louise, are you there?
Hello, yes, I am. Thanks for having me on today. My question's about younger children and whether you think that the government has followed the science on primary school children and including them in the Rule of Six, or whether you think the devolved nations have taken a better view on excluding them.
So yes, in the Rule of Six in England, that includes children. I think if you're in Scotland or Wales, then children are excluded. Who's got it right? Anybody willing to comment on that? Zubaida.
I actually don't know who's got it right, other than the fact that we have said from the outset, Independence Age, that children are less likely to be symptomatic and therefore less likely to spread, particularly younger children in primary school. So there's that issue. But what I would say actually is it's not straightforward that we've got a rule of 6 in England and not a rule of 6 in the other nations, because in England, and I've heard this through lots of people I know with children, it's quite easy to circumvent it. So you can circumvent the rule of 6 with children by going to games places to have a party, and then you can have 30 children. So there are lots of ways where you can circumvent it, which means that actually it's not a very good measure or a straightforward measure. But I would also argue that we mustn't talk about children as though they're one big homogenous group. As Christina, as Professor Pagel has pointed out, 16 to 24-year-olds are much more likely to spread COVID than younger children, or at least that it seems that way. So we need to distinguish that way as well.
Thank you very much. And we have time for a final related question from Jill. Jill.
Hello there. Thank you very much for taking my question. I'm clinically vulnerable and I live in the northeast, one of the areas with restrictions. I'd like the choice to temporarily educate my child at home just until cases are lower in the community, and we don't have a situation where schools locally are closing because of multiple cases. The school won't allow this. They say that I must send my daughter into the classroom where there's no social distancing, or permanently take her out of school, otherwise I'll be fined and I could be prosecuted. I can't shield from my child if she goes to school, because I think that would affect the mental health of both of us. And I know there's lots of other parents in this similar position. I'm just wondering if anyone has any advice for parents like me.
Any advice for parents? Anthony?
This has come up before, and I have a lot of sympathy for you. We've had some letters about this from other people who are vulnerable and are worried in a high transmission scenario of sending their children, who could then bring the infection home. And and I think they do need to have some shift in their views at educational authorities. I think it's quite wrong for you to be, have your child expelled from school or you fined or anything in this a rapidly changing situation. So I have a lot of sympathy with you. And I think you should get, if you could get your GP on side to say he would recommend that because of your vulnerability that, your child is, how old is your child, by the way?
My child is 6, so she is younger. But then there's no social distancing in the classroom, and there are cases locally.
No, exactly. But nonetheless, I tend to have a great deal of sympathy for your position, and I think the medical arguments could well outweigh any educational issues there. I think we have to be much more flexible. I don't know if other people on the panel disagree with me, but
Zubaida, did you have your hand up there?
Sorry, I was trying to unmute myself. Did I manage? Yes. So, I agree with Anthony. It's so difficult, I think, when you're in a vulnerable position, and especially as a parent, when you know that your child has missed over 6 months of school. You want them back because school has so many more benefits other than education, psychological benefits, the peer-to-peer impact, the social psychological benefits of being with other children. So it's a really difficult balance. But I would go back to what Susan, my colleague, said earlier, and what we said earlier in our education report from Independence Sage, which is, why isn't the government using much more venues, many more of those venues that are not being used, because that would limit the spread between children. And I think that's the key point, which is what more can the government do to help schools with minimizing the spread, in terms of distancing, in terms of ventilation. Ventilation is very expensive. We've said before that a lot of schools are old. They don't have straightforward opening and closing of windows. All of that needs major investment. So we need to put pressure on government again to pour resources into schools to help minimize that spread. But I think otherwise I would echo the points that Anthony has made about getting local authorities to be flexible and sensitive when it comes to vulnerable parents and also people in overcrowded and multi-generational housing.
Yes, I think questions of what is normally legal and ethical are very, very different in a time of pandemic. We have got so many other questions that we could have asked today, but we need to bring things to a close this Friday. And so what I would like to do now is, as per our tradition, invite Sir David King to wrap up today's briefing.
Thank you very much, Alice. What I would like to do is just translate what the experts have been saying into very simple language. How do you bring any epidemic to an end? There's not too many choices in front of us. We'd say, first of all, isolate all those with the virus from the rest of the population. Secondly, if you don't manage to isolate because, for example, you haven't got the testing capacity, put everyone into lockdown. Thirdly, if there's a vaccine, use the vaccine. Now, I'm just going to suggest that we went into lockdown on March the 23rd in the first place because the government abandoned the test and trace policy that they had in place early on because it couldn't cope with the number of people who were going down with the disease. And so they went into lockdown. They went into lockdown very late. And when an epidemic is growing at fourfold a week, which is what it was doing, it means that your capacity to manage the epidemic gets more and more difficult by the hour. So here we are in a situation where once again, we see that in a week's time, according to Christina's analysis, we will be roughly where we were on the 23rd of March, when we went into lockdown in the first place. And also, we know that the testing system, which began to fail from the moment it was instigated, it hasn't really functioned fully at all, but really began to fail very badly 2 or 3 weeks ago, is still day by day getting worse. So we don't have a test and trace capability, and that is why we're having to discuss the business of lockdown or circuit breakers and so on, because we have never built up that capacity for test and trace. And what I would say to government, because you will not develop the test and trace system fast enough now, is don't waste a moment. Take the steps that are necessary to slow down the pandemic in its tracks today. This evening, for example, Prime Minister, please introduce the new policies with clarity on whether it's a partial lockdown, a total lockdown, whether it's a circuit breaker, introduce them right away. And when you do that, don't sit back. Make sure that you have a fully functional find, test, trace, and support system in place so that people can go into lockdown. Not everyone can go into isolation. We need all of that put in place. And we know that the 2 private companies that have been employed have totally failed to deliver. So we now have to go back to the public health system and put money into the public health system so that they have the capacity to deliver locally. Thank you.
Thank you, Sir David. Thank you to our panel. Thank you to everyone who's been watching. All the reports that have been published by Independent Sage are available on the website, along with details of the whole team. Do follow Independent Sage on Twitter if you're not already. And we'll be back, same time, same place, next Friday. Have a good weekend. Stay safe. Keep well.